Good day. I am CarenKristia Adora, and I will talk about the pre-sternal catheters. The following are the objectives of this presentation. First is to describe what a pre-sternal catheter looks like. Next is to identify the reasons why we use the pre-sternal catheter. Next is to enumerate the advantages and disadvantages of the pre-sternal catheter. Next is to enumerate the preoperative procedures for pre-sternal catheter insertion. Next is to enumerate the postoperative care interventions. Last is to review the procedures for chronic exit site care. Let's talk about the pre-sternal catheter. The pre-sternal catheter is a swan neck catheter which has an anterior chest exit site, which is a variation of a lower abdominal catheter, which is located usually here. It has a titanium connector that connects the two divisions of the catheter internally. First, the upper section, which has a pre-formed bend with two cuffs, which are the pre-sternal subcutaneous cuff and the pre-sternal middle cuff, and an external segment. The lower section has the Missouri intraperitoneal design with a deep cuff, flange, and bead. The pre-sternal catheter is never placed over the sternum in case the patient has to undergo an open heart surgery. Why do we use the pre-sternal catheter? We use the pre-sternal catheter because the chest wall has less movement. Therefore, healing takes place and trauma risk is decreased. Second, patients with ostomies who are incontinent, who have obese abdomens, or who want to tub bathe may benefit with this catheter. What are the advantages of the pre-sternal catheter? The pre-sternal catheter allows healing because there is less movement over the chest. It has lesser chances of exit site infections and tunnel infections. The pre-sternal catheter is not rubbed against the belt. The chest has thinner skin than on the abdomen, which allows the exit site to heal easier. It is for patients who has ostomies, incontinence, obese abdomen, or who want to tub bathe. Let us talk about the disadvantages of the pre-sternal catheter. The dialysate flow rate is slower when compared to abdominal catheter because pre-sternal catheters are longer in length and its curved configuration. Body image issues due to its location, and there is a risk of disconnection between the upper and lower sections. What are the preoperative preparations before inserting the pre-sternal catheter? Pre-sternal catheter should be inserted 2 weeks before starting the dialysis for tissue ingrowth and prevention of dialysate leaks. Nasal cultures are done to detect S. aureus carriers. To plan for the exit site, examine the patient while dressed in standing and sitting positions. Avoid any previous scar when planning for the location of the exit site. Ensure that the exit site is visible. Bowel preparation is done on the day before catheter insertion. The following are used: 2-liter polyethylene glycol solution, stimulant suppository or enema. Agents containing phosphate and magnesium are avoided. Shower using the chlorhexidine soap on the day of the catheter insertion. Empty the bladder or insert a Foley catheter. Clip the hair from the surgical site. Administer IV prophylactic antibiotics at the time of catheter insertion. Let's talk about the post-operative care after catheter insertion. Dressing should be done weekly for the first 2 to 3 weeks to prevent contamination and trauma. A septic technique is used. Use face mask, sterile gloves, and sterile dressings. Contaminated or wet dressings should be changed at once. Non-occlusive dressings are used. If peritoneal dialysis has to be started before the standard 2-week post-operative period, as in early start peritoneal dialysis, that occurs 3 to 14 days after insertion, or urgent start PD, that is within 72 hours of insertion, peritoneal dialysis is done in a supine position with fill volumes of 0.5 liters to 1.5 liters using the manual exchange or automated PD. Immersing the exit site into the water should be avoided. Immobilize the catheter to prevent trauma. Let's talk about the long-term exit site care. Chronic exit site care starts 2 to 3 weeks after catheter insertion when the exit site is healed. No gapping, erythema, drainage, crusting, or tenderness. Exit site care is done for at least twice weekly and with every shower. However, care is done if the dressing becomes wet or soiled. Wash hands before touching the exit site or catheter. Liquid soap or non-cytotoxic antiseptic is used. Topical antibiotics such as mupirocin or gentamicin is applied on the exit site daily. Avoid removing the scabs or crusts. Avoid scratching the exit site. Avoid tension, tugging, or twisting, rubbing, or pressure on the exit site. Avoid agents that cause irritation to the skin. Healed exit sites can be submerged in chlorinated pools or unpolluted oceans. Avoid submerging the exit site into the lakes, rivers, streams, bathtubs, or hot tubs. After swimming, exit site care should be done. Immobilize the catheter at all times. Non-sterile dressings can be used. This is the end of my presentation. I hope you have gained knowledge about external catheters.